So still on posture and low back pain, here you can see, as I described, a picture sort of from the side of the body. So not only do we want to create sort of a symmetrical posture from either side of the body, but we also want to create a symmetrical posture down sort of through the middle of the body if we were looking at the side of it, so from front to back. We want to be able to create that symmetrical posture from front to back. And again, sort of following on from what we were just talking about, this is again going to create or reduce the pressure on the joints of the body, because as you can see in the diagram on the left hand side with the red boxes around it, you can see he's got sort of a head forward, his shoulders are rounded, his hips are poking forward, and his knee is in a sense sort of misaligned with his ankle. And again, this is creating pressure throughout the body, but not this time from side to side, but from front to back. So what we might be able to see from here, so again, looking at static postures from the side is going to help us identify this. And not only that, it's also going to help us identify it whilst we're moving as well, because again, you can get someone to a professional or a friend, or if you've got mirrors, you can look at yourself from the side and you can start to see maybe where your posture misalignments or asymmetries are. So finally, just looking at how incorrect postures sort of manifest themselves or create themselves, well, incorrect postures stem back to, and there's a few things that they stem back to. The first one is overuse and misuse, and then the second one is a traumatic injury. Now, overuse and misuse can lead to a traumatic injury. But what we have to understand is that they're both doing it, and probably the more common one is overuse and misuse. And I'm going to talk further about overuse and misuse in the next few slides. But basically, if we are overusing our body will become fatigued. And if it becomes fatigued, it then is left open to injury, let's say. So we have to be able to use our body correctly. And that's obviously not in just the amount of work that we're doing, which is overuse, but it's also misuse, which is the quality of movement that we have. So if we are lifting repeatedly throughout the day incorrectly, even if we do that a few times a day, that's still going to accumulate over a period of days, weeks, months and years. So it may not be sort of overuse in any one period of time, because it can extend itself out over weeks, months and years. So we have to be able to use our body correctly and not overuse it. We have to be able to use our body correctly and not misuse it. So by lifting, walking upstairs, pushing doors open, pulling doors open in a correct way. Now they seem like very menial tasks, doing walking, and this is something I ask the students in the classroom, is that can I have a show of hands for everyone who can walk? And majority of the time everyone puts their hand up. Well, all the time everyone puts their hand up, I would hope. But then I ask them another question: who knows how to walk correctly? And then they all sort of look at themselves and a few hands go down. And that's the key to it. That's the key to overuse and misuse, is not just being able to do the task, but being able to do the task correctly. And this is in a part where exercise comes in, because again, I'll ask, who knows how to do a squat? All their hands will go up. Then I'll ask, who knows how to do a squat correctly? And then they'll look at themselves, they'll look at each other, and some hands will go down. And this is the key with the industry at the moment. Exercise is promoted, just going and doing the exercise is promoted. How the exercise is done isn't normally promoted, is not promoted that heavily. So you've just got a bunch of people going into these gyms who are just going and doing what they think they need to do, and there's not any regard with how they're doing it. And this is the key when it comes to walking upstairs, carrying things, pushing doors open, pulling doors open. There is a correct way of doing it, or there is a better way of doing it. It's just the majority of people who are out in the world are just going, well, it's a door, I push it and it opens. They don't really take into consideration what the legs need to be doing, what the arm needs to be doing, what position the head needs to be in, what position the wrist needs to be in. So they're just sort of going around doing all these things, and without even realizing it, they're overusing and misusing the body. Now, traumatic injury is something slightly more extreme. So this might be if you've been in a car crash and you've got whiplash, or you've been again in a car crash and your hip then all of a sudden starts to hurt, or you went through a spate of twisting your ankle, and or someone in a rugby tackle or playing a sport, and you injured your knee or something like that. So those are the types of traumatic injuries. Now obviously the traumatic injuries will create a muscular imbalance, which will, if it is a twisted ankle, it will create a limp, or a bad knee or a hip, it will create a limp. And then once the injury heals itself, it won't necessarily go back to the way it originally was. It will create some of the muscular imbalances and joint imbalances in that leg. So what we have to do is we have to teach correct movement once the initial healing process has sort of run its course. So with regards to incorrect posture, we have to be looking at, are we overusing and misusing our posture or our body, and also have we had any traumatic injuries in the past? So have you been in car crashes? Did you used to play a sport? Even if you were playing sport, that overuse, that constant running, training 2 times a week, and then going to the gym a couple of times a week, all of that will contribute towards overuse and misuse, but also a traumatic injury. So, did you have a load of twisted ankles? Did you have very weak knees and injured your knees as kids and things like that? So we have to sort of think about our body in that way, because that again is going to help us overcome and reduce lower back pain in the future. Now we've kind of finished on the posture and the low back pain. Now we're now going to look at what is this posture and low back pain potentially going to cause in our body, and what are the warning signs to help us identify low back pain and how maybe serious it is and how we can overcome it.